2020 coronavirus outbreak in Japan. The 2019-20 coronavirus outbreak was confirmed to have spread to Japan on January 23, 2020. Timeline. January. A 30-year-old Chinese national who had previously traveled to Wuhan developed a fever on 3 January and subsequently returned to Japan on 6 January. He tested positive during a hospital admission between 10 and 15 January. He had not visited the Huanan seafood wholesale market, but possibly had close contact with an affected person in Wuhan. On 24 January, a second case was confirmed by a Chinese national who visited from Wuhan. On 25 January, the third case was confirmed in a woman from Wuhan. Japan has been taking extra precautions, due to the upcoming 2020 Summer Olympics being held in Tokyo. Despite this, on 28 January, the 5th, 6th and 7th cases were confirmed in Japan, including a man who has not visited Wuhan. This man was reported to be a tour bus driver who had driven a group from Wuhan earlier in January. The guide of the group has also been confirmed positive to the virus. On 29 January, a Chinese man and woman in their 40s were tested to be positive for the coronavirus in Aichi and in Hokkaido. On 30 January, it was announced that 3 Japanese nationals who arrived at Haneda after being evacuated from Wuhan tested positive. 3 other cases were confirmed on the same day. Prime Minister Shinzo Abe announced 2 Japanese nationals who came back via Haneda refused requests to be further tested and said that officials cannot legally force them to do it. It was announced on 31 January that the 2 had relented. February. From 3 February, Japan will not admit anyone who has history of traveling to and from Hubei province or has a Chinese passport officially issued from Hubei. In addition, non-Japanese travelers are required to fill out health declaration questionnaires on whether they have, or will, travel to Hubei within 14 days. On 11 February, 2 evacuees from Wuhan were tested positive after an earlier test returned negative results. Another 3 cases were confirmed over 2 days, bringing the total to 31. On 12 February, Japan announced entry restrictions for anyone who has traveled to and from Zhejiang or has a Chinese passport issued from Zhejiang. On 13 February, a woman in her 80s infected with the coronavirus died in Kanagawa Prefecture, next to Tokyo, the first death of a person infected with the virus in Japan. She is the mother-in-law of a cab driver working in Tokyo who has been confirmed to be infected with the virus. On 14 February, a married couple, both in their 60s, tested positive after returning from a 10-day vacation in Hawaii, during which the man began showing symptoms. On 16 February, it was reported that they used Delta Airlines to return to Tokyo from Oahu and stayed at the Grand Waikiki Inn. Contact tracing was already launched by the airline to determine if anyone else caught the virus. On 18 February, Wakayama Prefecture announced that 3 people were confirmed to have the virus, with one of them being a patient at the Seizukai Arita Hospital. The other 2 consist of the son of a doctor who was tested positive and a nurse in his 30s who worked as a member of the disaster medical assistance team after being deployed to the Diamond Princess. On 20 February, Fukuoka Prefecture announced its first virus case with a Japanese man in his 60s with no travel history overseas. On 21 February, 2 elementary school boys in Hokkaido and 1 preschool schoolboy were confirmed to be infected with the coronavirus, the latter coming back from an airlift out of Wuhan with his father, who was also confirmed positive with the virus. On 22 February, a junior high school teacher working in Chiba Prefecture was confirmed to have the virus. On 23 February, the U.S. State Department warned American visitors in Japan to be cautious due to the community spread of the virus. It was reported on the same day that the Nagoya Expressway Public Corporation announced plans to temporarily close some toll gates and let employees work from their homes after an employee manning the toll gates was diagnosed to be positive for the virus. Due to personnel shortages, 6 toll gates on the Tokei and Manba Expressway are expected to be closed on the weekend. Impact. Prime Minister Shinzo Abe has said that the new coronavirus is having a major impact on tourism, the economy and our society as a whole. Face masks have sold out across the nation and stocks of face masks are depleted within a day of new arrivals. There has been pressure placed on the healthcare system as demands for medical checkups increase. Chinese people have reported increasing discrimination. The health minister has pointed out that the situation has not reached a point where mass gatherings must be called off. Aviation, retail and tourism sectors have reported decreased sales, and some manufacturers have complained about disruption to Chinese factories, logistics and supply chains. Prime Minister Abe has considered using emergency funds to mitigate the outbreak's impact on tourism, of which Chinese nationals account for 40%. S&P Global noted that the worst-hit shares were from companies spanning travel, cosmetics and retail sectors, which are most exposed to Chinese tourism. Nintendo announced that they would delay shipment of the Nintendo Switch, which is manufactured in China, to Japan. The outbreak itself has been a concern for the 2020 Summer Olympics, which is scheduled to take place in Tokyo starting at the end of July. The national government has thus been taking extra precautions to help minimize the outbreak's impact. The Tokyo Organizing Committee and the International Olympic Committee have been monitoring the outbreak's impact in Japan.